Here you are watching drug-induced sleep endoscopy with breath monitoring in a 45-year-old man with history of snoring and choking. You can see completely mouth breathing. His body mass index is 30, so he's overweight. Uh, and his apnea and hypopnea index is 73. Almost all are apneas. In the nose, he's got a deviated septum on the left. As you can see here on the CT scan, there's some patchy mucosal thickening in all the sinuses. So out of 73 AHI, almost 69 are apneas. And a tonsillectomy has been done earlier. The tonsillectomized patient. There's a little bit of adenoid, not much. Salpingopharyngeal folds, grade 0 by Aguas classification. And you see it's a complete collapse of the lower part of the velum. So in spite of the tonsillectomy, you can see that the soft palate was completely collapsing. As I go beyond the soft palate, you can see the base tongue also going behind and touching at the back. I'll try to now keep his mouth closed and let's see what happens. And I keep his mandible pressed against both the teeth touched to each other. Let's see what happens now. This is in the correct range, 78. Now his tongue base is not large, right? You can see the whole thing is just trying to contract. But as I keep his mouth forcibly closed, you can see the palate is still collapsing, completely collapsing. But the collapse of the base tongue and the epiglottis becomes a little less. Now his mouth is completely closed. He's a mouth breather, completely mouth breather. He's still trying to open his mouth very forcibly. I am keeping it forcibly closed. Now see, then the base tongue goes less backwards, but the palate is completely obstructing. Length of the palate is quite a bit, you can see. Now I'll try to put a nasal uh, airway. All right. Obviously, the airway can only go from the left side, from the right side. The left side cannot go. So give me a moment. I'll put the nasal airway very gently. One sec. I'll just try with the nasal airway. One one sec. And I'll pass it through the soft palate so that we can bypass the nose and the palate, and we'll see what happens. Now the nasal airway is in place. I'll try to go through the nasal airway. Uh, yeah, I'm trying to pass the scope through the nasal airway. Getting stuck. All right. Now with the nasopharyngeal airway, can see that's the epiglottis and the base tongue. Once the palate is bypassed, nose and the palate is bypassed, you can see his tongue collapse is also less. Epiglottis is not collapsing at all. So that's, and now I can keep his mouth closed much easier because he's able to breathe. Earlier he was struggling to breathe, and therefore now only with the nasopharyngeal airway he is able to breathe much better. The palate is bypassed, and that makes sure that he will do extremely well. See, now the base is again in the 70s, correct range. He is still sleeping on his back, right? So his tongue base and epiglottis is not the problem. All right. His major problem is in the length of the soft palate. The tonsil is out. It was a purely AP collapse, and he requires a septoplasty, turbinoplasty, sinus surgery, depending on what is there in the CT scan, and uvulopalatopharyngoplasty. The uvula removal, the length of the soft palate has to be reduced. Only by pulling it a little bit here and there will not give results. We have to reduce the length. It's a pure AP collapse, and he should get a great result. He's very young. He's only 45. So he should definitely get a great result. So now we are at the base of 74, and we have waited for almost a minute. Very, very correct understanding of the airway. Now let me pull this whole airway out, and you will see the start collapse of the uvula, the soft palate again. That's the length of the soft palate. And the moment I take it out, let me just remove the airway, and we'll see what happens. Now you see again he has started opening his mouth completely. That's because he cannot breathe through the nasopharyngeal airway passage, and a complete collapse of the soft palate. Can you see that? Even if I now try to again close his mouth, he's resisting it quite a bit because he's unable to breathe. So it's a very, very clear demonstration that his problem lies in the soft palate. Thank you for watching. Nose and the soft palate.